Well, welcome everybody, and thanks for making this this presentation. We are quite excited to present this data. So I'm going to start just by giving you a little bit of the background of the research that we just recently finished, really, and then Maria Laura is going to tell you more about the results and our findings and what we think it is important to implement as action to improve the current situation. So in this study that we started basically just not much longer than 1 year ago, when the pandemic, we were in the full pandemic really at that point, in the lockdown, we wanted to explore how pregnant women were doing at that point in terms of mental health, and also in terms of antenatal attachment. So this first relationship with their own baby still in the womb, and also how they were perceiving social support from their partner, the family, and also from the healthcare system, so mainly midwives here in the UK. Maria Laura, can you move on? Yeah. Okay. So we might quite all vividly remember when everything started longer than a year ago now. All the measures and the focus was all about, the negative physical health outcome of contracting the COVID-19, the mortality, and obviously this had, priority in terms of the measures that had been implemented at that time, which were quite unusual and obviously antisocial. So we had to work from home, schools were closed, practicing social distancing everywhere we went. There were closure of leisure activities, and all of this that was quite strange, but obviously a priority at that point. However, we are realizing now, or we have realized in the recent months, that all of these important measures also had quite an important effect on our psychological outcomes. And in fact, the research actually indicates that in times of natural disasters, like for example pandemics, we are all quite more vulnerable to mental health problems. So we tend to increase our symptoms of depression, anxiety, post-traumatic stress disorders, and so on. It's also true, though, that individuals are differently affected by the outcome of natural disasters. And we know that women and men react differently, for example. And then there are people who are more vulnerable. And what we know also is that in times where life-changing events, like for example pregnancy, we also are even more vulnerable to the impact of these disasters. So we now turn our focus to expectant women, and we know in fact that already pregnancy represents a vulnerable time in terms of mental health problems. And in fact, we know that there is quite a high prevalence of depression and anxiety in pregnant women, with about 20% of women reporting clinical symptoms of depression and anxiety. What it is important to remember here, though, is that this is only what we know. The percentage of that 20% is what we know from women that actually report and are detected by practitioners as suffering from mental health symptoms. But there is also quite a higher percentages of women who usually might go undetected by practitioner because they report subclinical symptoms of mental health problems. And this can go up to 40% of women experiencing this kind of symptoms. But as I said, most of the time they just go undetected. it is important to know this because there is research actually showing that whether the symptoms are clinically, at the clinical threshold or at the subclinical threshold, the outcome and the impact is quite similar in both cases. And also not just in the present, but also in terms of long-term outcomes, both for the moms and obviously also for the infants and the children later on. In this research, we focused on the immediate impact that even subclinical symptoms have on the relationship with the fetus. We know that it is during pregnancy that the relationship between a mother and a child actually starts. So we also need to focus on that particular time and try to understand what's going on in there. So there were quite a relatively, bad news in these first slides. However, there is also some good news. And in fact, some research also tells us that there are some factors in our environment that actually can protect us and protect pregnant women from the adverse effects of mental health symptoms. And one of these is actually social support. And there are a few research and evidence from the literature that find both a direct effect of social support for maternal antenatal attachment, for example, so that social support is found to directly promote maternal antenatal attachment. And there are also evidence that social support can play a role as mediator between, for example, maternal anxiety and the impact on maternal antenatal attachment. So in this example of the study reported here by Hopkins and colleagues, they found that when social support was high, the anxiety of the mother had a smaller impact on her attachment to the fetus. So for all of these reasons, Maria Laura now will tell you exactly a little bit more what we focused on our research. But I hope to have provided you with a little bit of background in terms of mental health during pregnancy, the vulnerability during that particular time, and the effect of the pandemic in this time as well. So, Maria Laura?
Thank you, Silvia. Yeah, so that's a great overview of the reasons why we came up with this study. And there's so we had two primary aims and therefore hypotheses for the studies. And because we know that trauma during the perinatal period, and especially prenatal trauma, heightens the risk of clinically significant mental health symptoms, we hypothesize that direct experience of trauma due to the pandemic would affect maternal antenatal attachment through, so indirectly, so as a moderator, by amplifying this vulnerability to mental health symptoms. There is a theory that is called intergenerational transition hypothesis that suggests that direct experience of trauma can impact on the caregiver-infant relationships. And given this recent evidence that trauma during the prenatal period can amplify the risk of mental health symptoms, we hypothesize that experiencing trauma during the pandemic would affect this relationship between mother and the fetus by amplifying the vulnerability to mental health symptoms. We, however, also wanted to focus, as Silvia said, on the positive sides and look at whether social support could be a protective factor, could buffer this impact. And we know that social support is associated with lower mental health symptoms. So it is reasonable to expect that high support during periods of trauma could be protective, particularly for those people that appraise the impact of the trauma or of the pandemic in this case to be more negative. So the more you are impacted by the negative experience, the traumatic experience, the more you're likely to develop potentially stress responses, mental health issues as a response. But if you have a high support, a high net of support, this could buffer these symptoms and protect against the negative effect of traumatic events by changing their appraisal. So for this specific study, we recruited women, pregnant women online, obviously, because we couldn't see anyone face to face. And we recruited 150 pregnant women who took part in the study online. These surveys were completed between April 2020 and January 2021, which roughly coinciding with the UK first and second lockdown. You can see a table of the demographics of the population. This gives you an approximate idea of who we tested and also hints to some limitations of the study. An additional data set from unpublished online research that was conducted before the pandemic by Sylvia was used also to compare some of the data on depressive symptoms to get an idea of the specific impact of the pandemic. So we had a pre-pandemic group and a post and a during the pandemic group. And we looked at differences in depression among these women. What we actually did was to give the survey to the participants, and they were asked to complete different standardized questionnaires on depression, anxiety, maternal antenatal attachment, and then we had a measure of the psychological impact of the pandemic. We used the impact of event scale, the revised version, which is a self-report measure of stress reaction after traumatic events. So in this study, this measure was used to measure stress related to the psychological impact of the COVID-19 pandemic. In addition to these standardized measures, we also asked specific questions in relation to the impact of COVID-19 and their relationships and lives. And these items specifically referred to the current time period since the most recent lockdown had started. And we looked at what we call the COVID-19 appraisal. So we asked participants, how badly do you think that you will be affected by the global effect of the pandemic? And the next series of items related to the perceived social support during the pandemic. And specifically, we asked questions about how well supported do you feel by your partner, your family and friends, and your healthcare professional midwives during this time. And they had to rate the perceived support on a scale from I don't feel supported at all to extremely. So it was a 5-point scale. So we go straight into the findings, and those are really the 3 key findings. And what we'll do then is to unpack each of them a little bit. So what we find is that the prevalence of mental health issues was quite high. So approximately 40–60% of the expected women that we tested reported symptoms of depression, anxiety, and post-traumatic stress disorder. When I say post-traumatic stress disorder, I refer to the impact of event scale that measured the stress response to COVID. So the psychological impact that the pandemic had on their lives. And what we see is also that the higher the depressive symptoms, the less these women were feeling attached to their unborn babies. So in relation to the antenatal attachment scale, we see that there were lower scores in those women that reported higher depressive symptoms. We also found that women who perceived the impact of COVID-19 to be more negative reported higher levels of anxiety. However, then this is the good news. Social support from partner, family and friends, and their healthcare system acted as a protective factor and was associated with lower anxiety. So people that felt higher support from their family, friends, partner and healthcare system reported also lower levels of anxiety. So let's look into these in more details. As I said, the prevalence of mental health symptoms that we found was quite high, and that this is, first of all, indirectly compared to what we know usually happens during pregnancy without the pandemic, but also in relation to the additional data set that I mentioned earlier. So what we found is that women pre-pandemic, pregnant women pre-pandemic, had significantly lower depression scores compared to women that were pregnant during the pandemic. And given that the usual reported incidence of depression and anxiety during pregnancy, as Sylvia said earlier, is around 20%, our study shows the extent to which the pandemic has impacted on expectant women's mental health. And what is striking is also a recent study that looked at maternal postnatal mental health during the pandemic showed that 43 and 61% of women self-reported symptoms associated with depression and anxiety. This is really striking because what we see is exactly the same rates during pregnancy. And those are two independent studies that provide converging evidence of the effect of the pandemic on women's mental health. As I said earlier, our results also show that expectant women with higher depression or depressive symptoms reported feeling less attached to their unborn baby, to the developing baby. And we think that this is also strongly related to the effect of the pandemic, because what we see is that women for whom COVID-19 had a higher impact were more likely to suffer from the depressive symptoms. So again, indirectly, what we see is that there is an effect of the pandemic in terms of like stress response that has impacted not just on the women's mental health, but also on how they relate to their unborn baby. And potentially these will have a cascading knock-on effect on the formation of the relationship once the baby is born too. But importantly, there's social support that could potentially be a protective factor. And this is something that we can do something about. We can't do anything about the pandemic, but we can protect these vulnerable people from experiencing negative outcomes by providing the right amount of support. Previous research has shown that an increase in stress can exacerbate symptoms of depression and anxiety during the perinatal period. And more recently, studies that have started to look at the psychological impact of the pandemic have reported this surge in psychological distress and anxiety in pregnant women. However, what we see here is that an increased support from social partners, family and friends, and the healthcare systems were associated with lower levels of anxiety. And this suggests that social support may protect against the negative effect of traumatic events. So the figures that you see here, especially if you look at the two top ones, really show that while on one hand, the higher the anxiety, the lower the support. On the other hand, anxiety was increasing as the psychological impact of the pandemic increased. So it looks like there might be an interaction there, suggesting that social support might protect against these negative impacts by lowering anxiety. So obviously, we think that these findings can have important outcomes in terms of policy recommendations. One thing that I think is at the forefront is that these findings might point to the necessity of really prioritizing support for all pregnant women in order to protect their health, but also their infants' outcomes. And we think that there are 3 key actions that we could potentially recommend in this direction. First of all, promoting awareness of the prevalence of these subclinical prenatal mental health symptoms is a necessary step to really open up a conversation about what happens during pregnancy in terms of emotional changes, and reduce really the stigma that is often associated with the mental health difficulties. By encouraging this communication of what is happening during pregnancy, we can also promote early detection of low mood and stress in pregnant women. And this will help identify problems as they occur, and also will prevent potentially long-term negative impact by not just acting quickly, but also by promoting timely intervention. So potentially how this can be translated is by appointing a specialist on perinatal mental health to develop screening programs that are able to assess these subclinical symptoms at the earliest possible opportunity. The second recommendation really focuses on the intervention strategies, because we see that prenatal trauma is a key factor involved in the surge of the symptomatologies that we see in these women, then targeting how we appraise this trauma, how much this is negatively impacting on our mental health, can potentially be a useful intervention. And at the same time, making sure that the right support is available to these women might help by protecting against these negative outcomes. Obviously, one key aspect is related to continuity of care, right? Because we know that continuity of care from pregnancy to postnatal period is associated with improved health outcomes, not just for women, but also for their babies. So really, public health practitioners are uniquely placed to fulfill many of the interventions and the challenges that are outlined by this research. What we think is important is to provide these professionals with the right tools and the right type of support to assess perinatal mental health difficulties from pregnancy to the postnatal period. And because we saw the impact of prenatal trauma on these women, we think that potentially integrating a trauma-informed practice or care into the maternity service would be helpful. So, and this includes really conducting early trauma screening and assessment for all, regardless of whether they report a trauma in the first place. And then one of the critical aspects relates to the fact that we found this association between depression and antenatal attachment. So we think that it might be really critical to evaluate maternal mood and bonding to the fetus, and providing really support to foster the attachment relationship during pregnancy, where we know that this relationship begins. So public health practitioners should really sustain and encourage responsive caregiving practices and promote awareness of mother-fetus interaction and the relationship that is established during pregnancy between mother and fetus. And again, we think this is important for all pregnant women, regardless of whether they display any potential mental health symptomatology or not. However, midwives should potentially systematically assess maternal mood in all women and identify when these poor mental health might be interfering with the ability to establish a positive relationship with the fetus. And what is important here is to gather data that could inform about the trajectories of how this relationship unfolds. So we think it might be important to fund research programs that are able to track across time change. So tracking change over time is important here to identify patterns of change across development and design an intervention that could help individuals at critical stages where these first symptoms might appear. And that is it. Thank you.